Good morning, all of you. Topic for my presentation is Revolutionizing Diabetic Retinopathy Screening in Rural Population, Smartphone versus Fundus Camera. Purpose of my study is to compare the efficiency of diabetic retinopathy detection by smartphone-based mydriatic fundus examination versus non-mydriatic portable fundus camera to improve screening of diabetic retinopathy in rural population, to facilitate early detection and thereby early referral and treatment of preventable blindness caused by diabetic retinopathy, to boost the screening process of diabetic retinopathy in an outreach facility. Materials and methods. A descriptive study was done on 280 eyes of 140 patients attending outpatient department of ophthalmology at rural hospital. All patients underwent fundus examination by non-mydriatic portable fundus camera, followed by dilated fundus examination by smartphone-based fundoscopy using smartphone and 20 diopter lens, and fundus examination by indirect ophthalmoscopy. Grading of diabetic retinopathy was performed using modified early treatment of diabetic retinopathy study grading system. Sight-threatening diabetic retinopathy was defined by the presence of proliferative diabetic retinopathy or diabetic macular edema. Sensitivity, specificity, and image quality were assessed. Selection criteria includes inclusion criteria, age group of more than 40 years, patients presenting to OPD of rural hospital with history of gradually progressive diminution of vision, both males and females patients who are willing to give consent, and patients who are known cases of diabetes mellitus type 2. Exclusion criteria includes inability or unwillingness to provide an informed consent, history of known retinal disease, history of intraocular surgery or of ocular laser or injection treatment for any retinal disease, extremely small pupil that affected image capture, or an opacity or any other condition in either eye that affected good bilateral retinal photography, conjunctivitis redi or any other inflammatory condition which causes photophobia, and gestational diabetes mellitus. Image quality. Photographs taken by both the methods were graded on a 5-level grading scheme as follows. Grade 0 was ungradable. No detail was visible due to media opacities like dense cataract or total vitreous hemorrhage. Grade 1 poor, only gross retinal details. Larger lesions like blot hemorrhages and dense hard exudates were detectable. Grade 2 is average. Major retinopathy details visible. Minor degrees of retinopathy like microaneurysms and intraretinal microvascular abnormalities or subtle new vessels not clearly detectable. Grade 3 shows good, that is retinal details fairly clear. Most of the retinopathy changes detectable. And grade 4 was excellent. All retinal details and retinopathy lesions clearly visible. These are the images depicting fundus photography taken by smartphone based and another one by non-mydriatic fundus camera showing mild vitreous hemorrhage. These are the another images. So the discussion in our study, there were no ungradable images in the fundus photographs taken with both the modalities, as none of the recruited patients had very dense cataract or total vitreous hemorrhage. When compared to smartphone-based fundoscopy, the clarity of portable fundus camera images were poor in some patients due to mild hazy media and small pupil, and in others possibly due to lack of proper focusing. Hence, some mild diabetic macular edema lesions and some subtle new vessels in the periphery in proliferative diabetic retinopathy were missed in the portable fundus camera images. Results are sensitivity and specificity for detection of diabetic retinopathy in smartphone-based fundus examination was found to be 94.73% and 93.97%, whereas in non-mydriatic fundus camera it was found to be 88.13 and 95.06. Diabetic macular edema was present in 20 patients based on the grading in both cameras. Smartphone-based fundoscopy showed that 71.92% had non-proliferative diabetic retinopathy and 10.52 had PDR, while the non-mydriatic fundus camera showed that 71.42 had NPDR and 10.71% had PDR. Image qualities of both the imaging modalities were compared and graded by the retina specialist. None of the images taken in both imaging modalities were ungradable, as none of the patients recruited had hazy media. The image quality of retinal photographs taken in smartphone-based fundoscopy was average in 34.9%, good in 56%, and excellent in 4.6%. In non-mydriatic portable fundus camera, the quality of retinal photographs was average in 66.8%, good in 21.9%, and excellent in none of them. So this is the table showing sensitivity, specificity, positive and negative predictive value. K agreement for the detection by smartphone based fundoscopy was found to be 0.88, and in case of non-mydriatic fundus camera it was found to be 0.83, which is excellent K agreement. So to conclude, this study proves that both of the imaging modalities readily meets the diabetic retinopathy screening requirements. Although smartphone-based imaging is better as screening tool, but not all devices are suitable in terms of image quality. This study concludes that both of the imaging modalities can prove as a cost-effective way for screening purposes in outreach facilities. And the sensitivity of both of them can be increased by investing in better resolution fundus cameras as well as training of images. Thank you.
Yeah, I have only one question. Which smartphone did you use? Because there are issues with the smartphone. You cannot use every smartphone for the fundus photograph.
Yes, sir. Samsung Galaxy S23.
That worked very well.
Yes.
So the point is that the flashlight, do you use a constant flashlight for it?
Yes, sir.
Then only you can see, isn't it?
Yes, sir.
And what that phone has inbuilt flashlight, continuous flashlight in it?
Sir, video mode was used, and video were captured, and the images were taken from the video.
Okay, what I do, I have a CandyCam app with me, which has
Yes,
a
sir.
continuous flashlight. But
Okay.
the camera, whatever camera, now the cameras have 3-4, lenses to capture photographs. Very difficult to find which lens is the best lens to capture those images.
Yes.
So initial phones which had only one camera and the flashlight was quite near to that was very useful in taking those photographs. Now
Yes.
it is very cumbersome and it is very